Dr. Ira Zunin, the director of the Manakai o Malama Integrative Clinic. And this morning we're talking about mercury and why a new study says you should limit something that all of us love to eat, and that's sushi. Good morning, Dr. Z, and thank you so much for joining us.
Thank you.
So what does the new study say in The Economist that just came out about mercury?
Well, it says that of all the fish tested in the U.S. streams, essentially the majority, virtually all of them, had some mercury in them. And so we're seeing mercury in freshwater fish. We're also seeing it in the marine fish.
And does that make, I mean, people in Hawaii just love to eat fish. Does that mean we're at risk, or are we safer? What does that mean for us here in the islands?
We're not any safer being out here in the middle of the ocean. The mercury really is in all the oceans now. And the most dangerous fish are the big pelagic fish. So we're talking about the ahi that we all love and the marlin. Those smaller kind of salmon, the reef fish, are not as much of a problem.
And what are you noticing in your patients in terms of exposure to these higher mercury levels?
Well, you know, we are seeing them, and we're screening for them fairly often now. And it's those people that love that sushi, trying to get off the red meat, having the ahi maybe 2, 3, 4 times a week, and doing that on a long-term basis. We're seeing those mercury levels go up.
And you know, for pregnant women, you know, it's common practice to limit the big types of fish that they eat, like the ahis and the mahi-mahi and that sort of thing. But does that mean people who aren't pregnant or men need to limit their intake as well?
I can tell you that the people of Hawaii are all at risk if they're big fish eaters. And you know, mercury is a serious thing. It likes to go in the body. It doesn't like to come out. And when the levels are too high, we can have, you know, nervous system issues, anxiety, tremor. There are problems that arise.
So what's considered a safe amount?
Well, I would say that if you're going to be having ahi once, twice a week max, and then if you really like fish, trying to stay away from the fowl and the beef, or don't eat that, then you really want to try to alternate the larger fish with some salmon, with some of the smaller fish. Even those tunas, the small tunas, are not so bad, those shibis.
Right. And the amounts that you're talking about, is that like a little sushi or a few cubes of poke here and there, or you're talking about big steaks a week?
Well, I'd say something in between. We're talking about a serious feed, not a little nibble.
Right.
Yeah.
Okay. All right. Dr. Zunin, thank you so much for joining us.
Important
information.
And the doctor